If you're a man past 50 and you've started making more trips to the bathroom than you used to, you're not imagining it, and you're definitely not alone. It's one of the most common changes men experience as they get older, yet almost nobody talks about it openly. Waking up 2 or 3 times a night, standing there waiting for the stream to start, feeling like you never fully finish, these are things millions of men quietly deal with, often for years, before they say a word to anyone, including their doctor. Today we're going to talk honestly about what's actually happening inside your body when this happens, what you can realistically do about it, and when it's time to stop guessing and get real answers. No gimmicks, no miracle promises, just what's actually true, explained clearly enough that you'll walk away understanding your own body better than you did 5 minutes ago. Let's start with the basics. The prostate is a small gland, roughly the size of a walnut, sitting just below the bladder and wrapped around the top of the urethra, the tube that carries urine out of the body. For most men, that gland goes through a second growth spurt somewhere after age 40 or 50. It's called benign prostatic hyperplasia, or BPH, and benign is the key word. It's not cancer, and having it doesn't mean something is seriously wrong with you. It's simply a very common, age-related change, driven largely by shifting hormone levels over the decades. But because the prostate wraps around the urethra, even a modest amount of growth can squeeze that tube like a kink in a garden hose, and that's where the frustrating symptoms come from. Here's what that squeezing tends to look like in real life. You might notice you're getting up more at night to urinate, what doctors call nocturia. You might notice the stream itself feels weaker, slower to start, or it stops and starts instead of flowing steadily. Some men feel like they never fully empty their bladder. So 10 minutes after leaving the bathroom they feel the urge again. Others notice a sudden, urgent need to go that seems to come out of nowhere, hard to ignore even for a few minutes. Any one of these on its own might not mean much, but if several of them are showing up together and getting worse over months, that's your body telling you it's time to pay attention. Now, here's the part that actually matters most, and it's the part a lot of content online tends to skip past in favor of dramatic promises. BPH is extremely well understood by modern medicine, and there are real, proven ways to manage it, most of which don't require surgery at all. The first step, always, is getting an actual diagnosis rather than guessing based on symptoms alone. A urologist can check your prostate size, test your urine flow, rule out infection, and, importantly, make sure your symptoms aren't coming from something else, including prostate cancer, which can sometimes cause similar warning signs early on. That's not meant to scare you. It's meant to explain why seeing a real doctor beats self-diagnosing from a video, no matter how well-produced that video is. Once BPH is confirmed, treatment usually starts with the least invasive options and works upward only if needed. Medications called alpha blockers are often the first line of treatment. They relax the smooth muscle in the prostate and bladder neck, which can noticeably improve flow and reduce urgency within days to weeks. Another category, 5-alpha reductase inhibitors, works more slowly, over months, actually shrinking prostate tissue in many men by targeting the hormone that drives that growth. Doctors sometimes combine both depending on prostate size and symptom severity. These aren't experimental or fringe treatments. They're backed by decades of clinical research and used by urologists worldwide every single day. Alongside medication, there are lifestyle factors that genuinely do make a measurable difference, and this is where the honest, evidence-based habits come in. Reducing fluid intake in the few hours before bed, particularly caffeine and alcohol, both of which irritate the bladder and act as diuretics, can meaningfully cut down nighttime bathroom trips. Regular physical activity has been linked in multiple studies to lower BPH symptom scores, likely because it helps regulate hormones and reduce the low-grade inflammation associated with prostate enlargement. Maintaining a healthy weight matters too. Excess body fat is tied to higher estrogen relative to testosterone, which some research suggests may contribute to prostate growth over time. None of these things will dissolve an enlarged prostate overnight, and no legitimate doctor will promise you that. But consistently applied over weeks and months, they can meaningfully ease symptoms and support whatever treatment plan you and your doctor land on. It's also worth saying clearly, if you notice blood in your urine, sudden inability to urinate at all, severe pain, or unexplained weight loss alongside these symptoms, that's not a wait-and-see situation that needs medical attention right away. Most BPH cases are far less urgent than that, but your body doesn't deserve guesswork when the stakes include ruling out something serious. The bigger picture here is simple. This is one of the most common, most treatable conditions a man will face as he ages, and yet shame and silence keep so many men suffering through it far longer than they need to. There is no trophy for toughing out bad sleep and bathroom anxiety for years on end. The actual path forward is unglamorous but real. Talk to a urologist, get properly evaluated, follow a treatment plan built for your specific case, and support it with the lifestyle habits that the evidence actually backs. That's not a secret. It's just something too few men are told plainly, without a sales pitch attached. So if tonight is the night you finally admit this has been affecting your sleep, your confidence, your relationship, your ability to sit through a movie without doing the math on where the nearest bathroom is, let it also be the night you decide to stop managing it in silence. You don't need a miracle. You don't need to wait until it gets unbearable. You need one appointment, one honest conversation with a doctor who actually knows your history, and the willingness to follow through on a plan built for you, not for a headline. Somewhere out there tonight, a man is lying awake for the third time, doing math on how many more times he'll have to get up before sunrise, telling himself this is just what getting older means. It isn't. Getting older is not supposed to mean surrendering your sleep, your confidence, your freedom to sit through a 2-hour drive without scouting rest stops in advance. That belief, the quiet, resigned "this is just my life now," is the thing costing men more than the condition itself ever could. Because the truth is simpler and more hopeful than the silence suggests, this is one of the most manageable conditions in all of men's health, and the men who take it seriously, who make one phone call to a urologist instead of one more night of guessing, are the ones who get their mornings back. They get their energy back. They stop planning road trips around gas stations. They stop excusing themselves from their grandson's baseball game in the third inning. They start sleeping through the night again, and with that sleep comes everything else: sharper thinking, steadier mood, the kind of quiet confidence that comes from simply feeling like yourself again. That transformation isn't a mystery, and it isn't locked behind some secret habit nobody wants to tell you. It's behind a door you have to choose to walk through, the door of your doctor's office. The door of an honest conversation, the door of finally treating your own health with the same seriousness you'd want a woman in your life to treat hers. If you take nothing else from these last few minutes, take this: your body is not betraying you, and it is not too late. Every single symptom we talked about today, the weak stream, the constant urgency, the nights fractured into pieces, has a name, a cause, and a real, proven path back to normal. The only question left is whether you'll keep carrying it alone, or whether today is the day you put it down. Make the call. Book the appointment. Say the uncomfortable sentence out loud to a doctor who has heard it 10,000 times before and will not flinch. Your sleep is waiting for you to reclaim it. Your confidence is waiting. The version of you that used to walk into a bathroom and walk right back out, that used to sleep 6 straight hours without a second thought, that man is not gone. He is one honest decision away. Don't let another night pass managing this in silence when the answer has been available all along. Take the step. Not tomorrow, not eventually. Now, when alpha blockers and 5-alpha reductase inhibitors don't bring enough relief, or when the prostate has grown large enough that medication alone can't manage it, urologists have a whole range of options before surgery even means what most men picture in their heads. Minimally invasive procedures have advanced enormously over the past 2 decades. Techniques like Urolift, which places tiny implants to hold enlarged prostate tissue away from the urethra, or water vapor therapy, which uses steam to shrink excess tissue, can often be done without a hospital stay and with a much faster recovery than traditional surgery. These aren't experimental novelties. They're established, FDA-approved procedures used specifically because they preserve normal function while relieving obstruction. For men who do need a more traditional procedure, something like a TURP, transurethral resection of the prostate, remains one of the most studied and effective treatments in all of urology, with decades of outcome data behind it. The point isn't to scare you into thinking surgery is around the corner. The point is this: even in cases where medication and lifestyle aren't enough, the next steps are well established, well studied, and designed to give you your life back, not take something away from you. Now let's talk about something that trips up a lot of men trying to research this on their own: separating real evidence from wishful thinking. You'll find no shortage of videos and articles promising that a specific fruit, tea, or supplement will shrink your prostate naturally within weeks. Here's the honest picture. Certain nutrients do have some research behind them. The zinc, beta-sitosterol, and saw palmetto extract have all been studied for BPH symptoms, and some trials show modest improvement in urinary flow and symptom scores. But some evidence of modest improvement in certain trials is a very different claim from this will reverse your enlarged prostate. Supplements aren't regulated the way medications are. Potency varies wildly between brands, and none of them have been shown to outperform standard medical treatment. If you're curious about trying one, that's a completely reasonable conversation to have with your doctor, not because it's dangerous to ask, but because your doctor can tell you whether it might interact with something else you're taking, and set realistic expectations about what it can and can't do. Diet deserves a bit more nuance too, because eat healthy isn't especially useful advice on its own. The dietary patterns most consistently associated with lower BPH symptom severity in research are the same ones associated with better cardiovascular health generally: more vegetables, more fiber, more healthy fats like those in olive oil and fish, and less red meat and processed food.